Alzheimer's disease is a disease. In fact, we call it a neurodegenerative disease, which is a long term, which just simply means that the brain brain cells are dying, neurons are degenerating. Okay? Neurodegenerative. And why are they degenerating? Well, when we look in the brains of people who I diagnose with Alzheimer's disease, we find very characteristic pathologies in their brain. I'll just say what they are. This is not intended to be a neuropath lecture, but there we see plaques of a protein called amyloid, and we see another protein that's normally found in the brain called tau, all tangled up. So you might have heard of the plaques and tangles of Alzheimer's disease. That's what my colleagues who are neuropathologists are seeing on the microscope. Plaques of amyloid and tangles of tau protein, which in a healthy brain would not normally be there. Okay. So when I say that someone has Alzheimer's disease, what I'm saying is that they've developed disabling cognitive problems, meaning they started out and developed and grew up with normal cognition, went to school, got a job, etc. But then over time, particularly after the 6th, 7th decade of life, they began to develop cognitive problems with memory, attention, concentration, and that these problems are interfering with their ability to do their usual and everyday activities. So the common story of a mild stage patient with Alzheimer's disease is repeating questions frequently. Asking a question, and 30 minutes later asking the same question, and 15 minutes later asking the same question, telling the same story over again, as though it hadn't been told the first time. Forgetting the day of the week, like not the date, no one remembers that anymore, but Monday, Tuesday, we're getting that confused. Confusing the finances. My grandfather presented with his Alzheimer's disease because his checkbook was unbalanced, and he was a math savant. And when we saw that, we're like, this makes no, he always had a meticulously balanced checkbook, and he just left it unbalanced, for example. Troubles with complex other tasks like directions to get someplace. Driving. So troubles with managing money, troubles with transportation, troubles managing complicated cooking. So a lot of patients come in around Christmas or after Christmas because the family says the Christmas meal just was no longer organized the way that she always used to. The baking wasn't done. So Alzheimer's disease is someone who has disabling cognitive problems because of, I've told you, the plaques and tangles in the brain. And I would diagnose them with dementia, and the cause of that dementia is Alzheimer's disease. So I hope I've impressed on you, not that you should know all these and be able to recite them, but to walk away and say, if someone is aging and developing cognitive problems, it ought to be taken seriously because it may reflect the disease that needs to be diagnosed. You say, well, why diagnose the disease? What are you going to do about it? Unlike cancer and diabetes, the two diseases I evoked earlier, where there are all kinds of medications, perhaps too many medications, to treat them. What drug can you do to treat this disease? And I guess I would counter with, I would agree with you, I don't have a miracle cure. I don't even have a drug for Alzheimer's that can dramatically slow the course of the disease. That you're right. But what I can tell you is that if you don't understand where you're at and what to expect in the future, you, the person with Alzheimer's disease, are a setup for a series of disasters. So, for example, I've had patients who come in where the problems that they tell me are months of mistakes with finances and defrauding, loss of thousands of dollars of money because no one kind of identified the problem, stepped in and took over the checkbook and monitored things. And so people took advantage of the person, etc. I've had patients in the summer wander far from home, lost, dehydrated, end up in an emergency room, and the rest is obviously the disasters that can occur from an older adult developing dehydration and going to the emergency room. I could go on and on about all those functional problems, okay? And then, of course, there's the family member who's trying to figure out, well, what is going on and what's the right way to communicate with this person and live with this person. There are more and less effective ways to communicate with someone who is repeating the same question over time. And how many, and I mentioned that one particular symptom because the family members in the research we've done, one of the most distressing symptoms for family members is the repetitious questions. Well, one of the things we do is educate family members for how to deal with and address the repetitious question problem, and how to manage the stress that they're experiencing living with someone who, for example, asks the same question over and over again, etc. or some of the other challenges later in the course of the disease, like how do I live with and cope with someone who gets confused about who I am and confuses who I am, doesn't recognize me for the person that I am and how I'm related. So what I'm trying to say is that, yes, I can't prescribe a drug that I can say will slow the course of the disease and delay substantially the time before you no longer recognize a family member, as for example. But I know that if I help you make sense of what you're dealing with, you the patient, and you the person or family living with and caring for that patient, I know you will do better, because research has shown that if you educate the patient and the family about the disease, what to expect in the future, how to live with it, you will substantially delay the time before the person needs, for example, 24-hour nursing care. And it's something about the brain and the mind, and I think we all know this. If you nurture it and take care of it, it does better than if you don't nurture and take care of it, even when it's got a disease that's causing it to degenerate.